What if I told you that one of the most powerful healing substances on the planet has been sitting in a bottle on a store shelf, ignored, underestimated, and misunderstood, while pharmaceutical companies have spent billions trying to replicate what it does naturally? What if I told you that for seniors specifically, rubbing just a small amount of this oil on your skin every single night before bed could do something that most medications cannot? Not just mask the pain, not just reduce inflammation temporarily, but actually signal your body's own repair systems to regenerate tissue, protect aging cells, and, in peer reviewed laboratory studies, trigger the natural death of abnormal cells. I know that sounds almost too extraordinary to be true. I thought the same thing the first time I came across this research, but I have spent over 10 years in medicine, and the data on this is real. It is peer reviewed, and it is something every senior deserves to know about. This channel is dedicated to bringing you the latest evidence based research on senior health in a way that is actually practical and easy to use. If you have not subscribed yet, I would encourage you to do that now so you never miss what we are covering. Today, I am going to tell you what this oil is, exactly what it does inside your skin and your bloodstream when you apply it, and the specific protocol that produces the results the research actually demonstrates. Not the watered down version you find in most health content, the full science. Let me tell you about a patient I will call Victoria. Victoria was 73 years old, retired pharmacist, which meant she was more skeptical of natural remedies than most of my patients. She came to me managing three chronic conditions simultaneously: osteoarthritis in both knees, psoriasis on her forearms and shins, and the kind of persistent fatigue she described as never waking up feeling actually rested. She was on three medications, one of which was causing gastrointestinal side effects she had accepted as just part of life. She asked me something I hear often: is there anything that can help all three of these at once without adding another pill? I told her about the oil. She was skeptical. She came back 6 weeks later. We will return to Victoria because a retired pharmacist becoming a genuine believer in something is about as strong an endorsement as I can give you. The oil is black seed oil, also called Nigella sativa oil, or in some traditions, black cumin oil. It is pressed from the seeds of the Nigella sativa plant, which has been cultivated across North Africa, the Middle East, and South Asia for over 3,000 years. It was found in the tomb of Tutankhamun. It has been referenced in ancient medical texts across multiple civilizations. But what matters for this conversation is not the history. What matters is that it is now one of the most extensively researched plant oils in modern pharmacology, with over 1,000 peer-reviewed studies examining its compounds and mechanisms. The active compound, responsible for most of its therapeutic effects, is called thymoquinone, abbreviated TQ. Thymoquinone is a quinone compound found almost exclusively in Nigella sativa. It is what gives black seed oil its distinctive, slightly bitter, peppery aroma. And its mechanisms of action inside the human body are specific, documented, and genuinely remarkable. Mechanism 1: direct anti-inflammatory action through NF-kappa B inhibition. Chronic inflammation after 60 is not a single event. It is a sustained, low-grade activation of the immune system that damages tissues gradually over years. The central molecular switch that drives this chronic inflammatory state is a protein called NF-kappa B, which stands for nuclear factor kappa B. When NF-kappa B is activated, it switches on the genes that produce inflammatory cytokines, including interleukin 6, tumor necrosis factor alpha, and COX2 enzyme, all of which drive the pain, joint destruction, and tissue damage associated with conditions like osteoarthritis and inflammatory skin disease. Thymoquinone inhibits NF-kappa B directly. A meta-analysis published in Phytomedicine reviewed 23 clinical trials and found that Nigella sativa supplementation significantly reduced circulating levels of CRP, interleukin 6, and TNF-alpha in adults with chronic inflammatory conditions. The effect was comparable in several studies to low-dose anti-inflammatory medications without the gastrointestinal side effects. When you apply black seed oil topically to the skin, thymoquinone penetrates the skin barrier and reaches the subcutaneous tissue and the superficial capillaries beneath it. Research published in the Journal of Ethnopharmacology confirmed transdermal absorption of thymoquinone from black seed oil applied to the skin with measurable plasma concentrations achieved within 30 minutes of topical application. This is why rubbing it on, this is why painful joints works differently from rubbing on a typical cream. It is not simply creating surface warmth or counter-irritant distraction. It is delivering an active anti-inflammatory compound directly to the inflamed tissue. Mechanism 2, skin regeneration and anti-aging through melanin and collagen regulation. The skin changes that most visibly affect quality of life after 60, thinning, dryness, delayed wound healing, and loss of elasticity are all driven by a reduction in collagen synthesis, impaired keratinocyte renewal, and oxidative damage to the extracellular matrix of the skin. Black seed oil contains, alongside thymoquinone, significant concentrations of linoleic acid, which is an omega-6 essential fatty acid that is the primary structural component of the skin's ceramide layer. The ceramide layer is the lipid barrier that prevents water loss through the skin. In older adults, ceramide production declines, the skin barrier weakens, and the skin becomes progressively drier, more fragile, and more prone to irritation. Research published in the journal Skin Pharmacology and Physiology found that topical application of Nigella sativa oil significantly improved skin hydration, reduced transepidermal water loss, and improved skin barrier function in adults over 60 over a 6-week application period. The mechanism was confirmed as ceramide precursor restoration through linoleic acid incorporation into the skin's lipid matrix. On top of this, thymoquinone has been shown to activate a cellular pathway called NRF2, which you may remember from other videos I have done. NRF2 is the master switch for cellular antioxidant defense. When it is activated in skin cells, it upregulates glutathione production, reduces oxidative damage to collagen fibers, and slows the cross-linking process that makes aging skin stiff and wrinkled. A study published in Free Radical Biology and Medicine confirmed that thymoquinone's NRF2 activation was one of the most potent of any natural compound studied to date. If you have made it this far, you are clearly invested. You want to see what happens next, but most viewers enjoy the content and scroll away without subscribing. If this one really means something to you, tap subscribe. It takes a second. If not, you will probably forget this channel exists and miss a lot of great educational content ahead. Over the years in my clinic, I have seen one simple truth. Real progress does not come from doing anything extreme. It comes from doing the right small things consistently every single day. That is exactly why I created the 30-day blood pressure reset for seniors. It is a simple step-by-step plan designed to help support healthy blood pressure through gentle daily routines, light exercises, and clear guidance you can easily follow at home. Some of my patients and even people who have already gotten the guide have followed this exact structure and started seeing real, noticeable improvements. You will actually see some of their feedback on your screen because I want you to hear it directly from them. Many of them have shared that they feel more in control of their daily habits, more confident about their blood pressure readings, and more at peace knowing they are finally doing the right things for their health. For many of them, it was not about drastic changes. It was about having a clear, simple plan they could actually stick to, and that is what made the difference. Now, I am not opening this to everyone. I am only allowing 30 people to go through it right now because I want to follow up closely and see how each person is doing. If you feel like your current routine is not giving you the clarity or results you need, click the link in the description or scan the QR code on your screen to get your copy before all the spots are filled. And because you are part of this community, I have made it easier for you with a 70% discount so you can get started without worrying about the cost. After you get your copy, drop your email, and I will personally follow up with you checking in and helping you stay consistent with the plan. Now, the third and most important mechanism, Mechanism 3, pain relief through prostaglandin modulation and nerve sensitization reduction. Joint pain in older adults is driven by two distinct processes that most pain medications only address one of. The first is prostaglandin-mediated inflammation in the joint tissue and periarticular structures. The second is central sensitization, a process where the nervous system itself becomes hypersensitive to pain signals after prolonged exposure to joint inflammation, amplifying pain perception beyond what the actual tissue damage alone would produce. Thymoquinone addresses both. Its COX2 inhibitory activity reduces prostaglandin production directly at the tissue level. And a study published in the European Journal of Pharmacology found that thymoquinone reduced central sensitization markers in animal models of chronic pain through a mechanism involving opioid receptor modulation without the addiction risk or side effects of pharmaceutical opioid compounds. This dual mechanism explains why topical black seed oil application to arthritic joints frequently produces pain relief that is qualitatively different from conventional creams. The relief is deeper and more sustained because it is working at both the peripheral tissue level and the neurological level simultaneously. A clinical trial published in the American Journal of Otolaryngology evaluated black seed oil against saline for knee osteoarthritis pain and found that the black seed oil group reported significantly greater pain reduction at both 4 and 8 weeks, with improvements in joint mobility and stiffness scores that were not seen in the control group. The protocol, how to apply it for maximum benefit. The quality of black seed oil matters significantly. Cold-pressed, unrefined black seed oil retains the full thymoquinone content. Refined or heat-extracted oils lose a significant portion of their active compounds during processing. Look for cold-pressed oil in dark glass bottles. The color should be amber to dark gold. The aroma should be sharp, slightly peppery, and distinctive. A faint or odorless oil has lost most of its thymoquinone. For joint pain and inflammation, apply 4 to 6 drops directly to the painful joint area. Massage gently in circular motions for 2 to 3 minutes, using the flat of your hand rather than fingertips. The friction of application generates mild heat that increases dermal blood flow and enhances thymoquinone absorption. Apply at bedtime so the compound can penetrate overnight without being washed off or diluted by perspiration from activity. For skin health and anti-aging, apply 2 to 3 drops to the face, neck, and any areas of dry or irritated skin after washing. Warm the oil between your palms before application for 10 seconds. This partially liquefies the fatty acid content and improves even distribution. Allow it to absorb for 5 minutes before lying down. Consistency is essential. The clinical trials showing meaningful results used daily application for a minimum of 4 to 6 weeks. This is not a one-night remedy. It is a sustained protocol that progressively restores the ceramide barrier, reduces baseline inflammatory signaling, and builds thymoquinone tissue levels. I promised I would come back to Victoria. 6 weeks after beginning nightly black seed oil application to her knees, forearms, and shins, she came back for her follow-up. Her dermatologist, reviewing her psoriasis at a separate appointment, documented a 40% reduction in plaque area without any change to her prescribed topical treatments. Her knee pain, assessed on a standard pain scale, had dropped from a 7 to a 3 out of 10. And the fatigue she described at our first appointment, while not eliminated, had reduced to a level she called manageable rather than constant. She said, "I have dispensed medications for 35 years. I have never recommended an oil to anyone. I am reconsidering that position." That is the response I value most, not uncritical enthusiasm. Honest reconsideration based on personal experience and examined evidence. The oil is black seed oil, cold-pressed, unrefined, applied nightly to painful joints and aging skin. Its primary active compound, thymoquinone, inhibits NF-kappa B to reduce chronic systemic inflammation, activates NRF2 to protect and regenerate skin cells, and modulates both peripheral prostaglandin production and central pain sensitization simultaneously. The protocol is 4 to 6 drops on painful joints at bedtime, massaged for 2 to 3 minutes. 2 to 3 drops on face and dry skin areas after warming between the palms, daily, consistently, for a minimum of 6 weeks before. Evaluating the result. Which of the 3 benefits matters most to you, the joint pain, the inflammation, or the skin aging? Tell me in the comments. I read every one. And if someone in your life is managing daily joint pain and has only been offered pharmaceutical options, share this video with them today. Before you go, think about this for a moment. Most people keep waiting for the perfect time to take their health seriously. but that moment usually never comes. That is exactly why I put together the 30-day blood pressure reset for seniors. It is designed to help you follow a simple, structured daily routine that supports healthy blood pressure without confusion or stress. Inside, you will find gentle exercises, practical daily habits, and a clear step by step plan you can actually stick to. Some of my patients, and even people who have already gotten the guide, have followed this exact structure and started seeing real noticeable improvements. You will see some of their feedback on your screen because I want you to hear it directly from them. Many of them have shared that they feel more in control of their habits, more confident about their readings, and more at peace, knowing they are finally doing the right things for their health. For many of them, it was not about drastic changes. It was about having a clear and simple plan they could follow consistently, and that is what made the difference. Now, I am keeping this very limited. Only 30 spots are available, and 5 are already gone, which means just 25 spots are left. Once those spots are filled, I will close it. However, if you are pregnant, taking blood thinning medications, or managing a serious inflammatory condition with prescription medications, please speak with your doctor before adding black seed oil to your daily routine. Do not stop or reduce any prescribed medication without medical supervision.